So once more, my name is Pedro de Paula. I am Vital Strategy Executive Director in Brazil on behalf of TAO and the program. I'd like to thank you all for attending today. We have over 60 people taking part in this important webinar about important risk factors for the Brazilian population's health and, the cost of alcohol to the country. And I'd like to ask to speak in English very, very briefly, just to provide some information to some English speakers and provide them with some
Good morning,
information for our
everyone.
event
I'd
here.
like to welcome you to our webinar on what alcohol costs to Brazil. And I would like to inform you that this event will be translated simultaneously. So if you click down there on the icon of interpretation, you can choose English for simultaneous interpretation. So I'll move back to Portuguese. Retomando aqui ao português, como eu disse.
Now, going back to Portuguese, as I said, I am the Executive Director of Vital Strategy. In Brazil, we are a public health organization that helps governments and civil society to promote policies to prevent health problems. And within the whole work of Vital, we have reset among with some of our partners with the Catholic University in Brasilia, ACT Health Promotion, PAHO, the Brazilian government, as well as some other players. International, we have John Hopkins Universities, WHO, among others. And the scope of the work that we do, Vital Strategies in ACT, we work together with Fiocruz to build this study about estimating direct and indirect costs attributed to alcohol consumption in Brazil. And this is what we're going to talk about here today. We are going to start by, well, we have the honor of having Senator Teresa Leitão addressing the issue of alcohol and its importance here in Brazil. After her, we have some videos recorded by Dr. Belisa Petro, who is the director of the Non-Communicable Diseases and Mental Health for PAHO WHO in Brazil, and also Dr. Cardoso, who is the director of epidemiological surveillance for non-communicable diseases from the Ministry of Health. In these videos will then be followed by Marcelo Bahia, who is advocacy coordinator at ACT, and then we're going to show the first stage of a dose of reality, or a shot of reality, if you will, which is part of our campaign about alcohol. And then after these brief initial comments, we're going to have a longer presentation by Dr. Eduardo Nilsson about his study, which is indirect and direct cost estimates related to the consumption of alcohol in Brazil. After this presentation, we're going to have a roundtable mediated by our director of non-communicable chronic diseases, Luciana Saidia, and she's going to bring the research director from the National Secretariat of Drugs, Policies, and Asset Management from the Ministry of Justice, Dr. Barbara Caballero, the head of the Nutrition and Food Technical Area and Physical Activity from the National Cancer Institute, Luciano Grutti, an expert on alcohol policies, Dr. Maristela Monteiro. In that moment, they're going to be able to answer questions that you may make on the chat. I believe that you have had the instructions come through when you registered for the webinar. So I would like to now invite Senator Teresa Leitão for her initial comments. And I'd like to wish everyone a very fruitful meeting. And thank you very much, Senator, for being with us today. It is an honor. Good morning, everyone. I would like to start by thanking for the invite to attend this meeting. And I would also like to put the Senate at your service to what is up for us, whatever is under the Senate's charge for this agenda. This is a commitment that I take up. From what I've read from the study, I'd like to say that this is a paramount topic for those of you dedicated to assessing these issues. And I'd like to highlight that within this context, what was actually surveyed was a new aspect that was pointed out by the study, which is included in the question, which is how much does alcohol cost to Brazil? This new study is going to reveal economic impacts, and as the economy is our driving force, as it were, we might be able to sensitize public health as we are trying to do with a motorcycle accidents, a lot of the times resulting from alcohol consumption, which have already shown to be a public health problem because of the size of the consequences, the time people are hospitalized for, and then have to do physiotherapies, the removal of workers from the actual working market. And sometimes it's not just recklessly being reckless or being in a hurry. A lot of the times alcohol is involved, and this is indeed a paramount issue. And I'd like to point out in this unprecedented study that addresses health-related impacts, but also brings us information related to how much alcohol consumption costs to public coffers. The study points out three aspects: diseases, cardiovascular diseases, liver diseases, and some types of cancers. It also points out the accidents, traffic accidents that do result from the use of alcohol, and also points out violence perpetrated by those who have been drinking or those who have been drinking falling victim to violence. We noticed that the great majority, over 80% of the study, points to being a male. But I'd like to point out an aspect in relation to the violence item, because if we open a tab for violence perpetrated against women, sometimes reaching extreme of feminicide, these perpetrators, a high percentage of them used alcohol, so they drink in the sense of being an alcoholic, or they are under the influence of alcohol when they actually engage in that violence act. And this is a worrying data which has been actually pointed out by gender violence studies. The index for women is much lower. While 74% of men actually reached by the use of alcohol, women is 26%. And finally, Pedro, I'd like to point out an aspect, because as a campaign is going to be released today, which is the sort of a shot of reality, which is a suggestive name, really. But I'd like to raise an aspect, which is the aspect of acceptability and how natural using alcohol is, because, in people's conscience, it is also related to, celebrations, parties, the friendships in the Northeast when we want to have a chat. So let's, pop over, have a couple of pints, have a couple of beers, and then you have two, and then you drink three, and then it's four, and then it's five. And there isn't really the possibility of planning a celebration, even like a family celebration, where there is no alcohol. So alcohol is very well accepted, I'd say, because this is linked, to the aspect of celebration, of festivities, friendship. And how can we work with this? What is the difference of a drink at a celebration to, reckless, uncontrolled consumption that takes and leads you to alcoholism and actually brings all these other problems that, we've been mentioning. The narrative, the whole sort of imagery around the drink, for me, it's not that it's just pointed out because, this is very well accepted. So ever earlier, adolescents are trying alcohol, and this brings all of these consequences that the study points to. I think that indeed this is an unprecedented study. The economic impacts definitely will draw people's attention, particularly if we're able to link them to the impacts to health, to social coexistence, and above all, the issue of violence. So I think, generally speaking, these are my considerations, Pedro. I'd like to reinforce that we are, at your service for this agenda to have reach reach visibility wherever possible, where, vital ACT, where you think it's possible to bring it to the Senate, please know that we are at your service to do so. So thank you very much for allowing me to share this moment with you, Madam Senator. Thank you very much for your words. I think that it brings to us the importance of this issue in its multiple layers, the matter of costs, for public coffers, the matter of health, violence, the injuries, traffic accidents, people's injury, and as well as the natural acceptance within our culture of this item. I believe that you covered all of this, and it is really a great honor to be able to have you, Madam Senator, in our parliament, moving forward with this agenda with so much engagement, knowledge, from the political sphere to be able to move forward with these issues. So it is really a great pleasure to know that we have this partnership and, have you in attendance here with us. So thank you very much. We have almost 90 attendees already, and then following on our program due to conflicts of time. Unfortunately, Dr. Elisa Petro, who is the Director of Equity and Chronic Non-Communicable Diseases at the Pan American Health Organization, PAHO, here in Brazil, she was unable to take part live, so she recorded a video that we're going to play to you now. Okay, good morning, everyone. I would like to say that I'm very happy to be here with you following this event virtually. I thank Vital Strategy for the invitation on behalf of Pedro, and I congratulate you for this release. We know that the consumption of tobacco, alcoholic drinks, ultra-processed food items is responsible for a great number of deaths associated to chronic non-communicable diseases, which leads to a higher a cause of deaths in Brazil and also in the world. In the region of the Americas, alcohol consumption is responsible for around 379,000 deaths every year. In 2016, it actually represented 5.5% of all deaths in the region. Fights uh, most lives were lost because of cancer as well as digestive diseases. In addition to impacts on health, the consumption of alcoholic drinks leads to economic, environmental, and social impacts. PAHO and WHO wishes to reduce the harmful consumption of alcoholic drinks recommended by the Safer Package by restricting the level of alcohol consumption, implemented measures against driving under the influence, promoting access to screening and also treatment, and also prevent, restrict advertising, sponsorship, and promotion of alcoholic drinks, and increase the price of alcoholic products through excise tax. Studies that show the direct cost and indirect costs, as the study being released today, as well as studies about environmental, social, and economic impacts related to the consumption of alcohol. They are critical for us to move forward in implementing these measures. I would like to conclude congratulating Vital Strategies and Fiocruz for this very important campaign and for releasing this campaign to inform everyone about the damage caused by the consumption of alcoholic beverages, because Brazil, within the Ministry of Health, is about to become a success story by passing healthy taxes, it were, on the consumption of tobacco, alcoholic drinks, as well as ultra-processed and sugary drinks, very much in line with best international practices. And know that you can count on PAHO, because together we'll be more effective for implementing strategic measures for preventing chronic non-communicable diseases, as well as reducing many avoided deaths related to the consumption of alcohol, tobacco, and ultra-processed products in the country. Thank you very much.
Once again, thank you very much, Dr. Elisa Prieto, for your video, the cooperation, the joint work, PAHO, WHO, for the partnership, and also for allowing us to contribute to the discussion of the safer package, as she explained. The Ministry of Health representatives won't be able to be here live, but we have received a video from Dr. Leticia Cardozo, working in the non-communicable chronic diseases department. Good morning. This morning, I'd like to greet my colleagues from Vital Strategies by greeting Mr. Pedro de Paula. Also, I'd like to greet Marcelo Bayard from Health Promotion at ACT, and also Mr. Eduardo Nilsson, who's going to present the results of the study. I would also like to greet all of you who are here present this morning and participating in such an important presentation of this study on the costs of alcoholic beverages to Brazil. I'm the director of the Department of Surveillance of Non-Communicable Diseases. So I need to highlight that alcohol is one of the main factors that cause non-communicable chronic diseases. And it has an important association not only with these diseases, but also other problems such as liver diseases, violence, mental health, death in traffic. So it's a very important risk factor, and it generates problems not only for health, but also for work and the economy of the country. We are at a very important time within the agenda of the tax reform. And we've been discussing the increase of taxes for these beverages, which represent a very important risk factor. And also the increase of these taxes is considered by WHO as the best or the most cost-effective measure for reducing the consumption of this risk factor. So I need to highlight this topic and ask for the society, health professionals, and all of you who are here watching us to understand the importance of this risk factor. There's no safe consumption of alcoholic beverages. And there is a set of regulatory measures necessary to move forward, because we are behind in this regulatory agenda on prevention and control of alcoholic beverages. It is very important to have such studies, to have them produced so it can add to existing evidences, so that we can have relevant information for the prevention and alcohol control in the country. I will close by saying that I wish you have a great event. I would love to be there with you, but unfortunately, I'm otherwise engaged. And I'd like to wish you all a great meeting. And I hope this information that's being conveyed is very important and useful for building public policy. Thank you to the Ministry of Health, Dr. Leticia Cardozo. Thank you very much. We heard her say that it's very important to remember that there's no safe consumption for alcohol to prevent the diseases we'll be talking about. And discussing today, and also the importance of the adequate taxation as the key measure recommended by WHO for the reduction of consumption and impact on health and people's lives. Now I will invite my colleague, Marcelo Bayard. He's going to give his talk now. Thank you, Pedro. It's a pleasure to be here with you. Good morning, everyone. Senator Teresa Leitão, it's a pleasure to have you here. I had the opportunity to meet her the first time when we were creating the health eating group in the northeast of Brazil. She's a great ally in these agendas related to risk factor for the development of non-communicable chronic diseases. I would also like to thank Vital Strategy for the partnership, as well as Philcros for such a relevant study. There are 3 things I'd like to share with you. The first one is that ACT Health Promotion works with 3 risk factors for the development of non-communicable chronic diseases: tobacco, alcohol, and ultra-processed food. And I'd like to bring a testimony, a more personal one. I've been working very closely to the legislative and executive powers, and I've seen that tobacco is more consolidated in regards to the harm it causes. And Brazil has already adopted a lot of actions to solve this problem. We've become a reference recognized by WHO for the control of tobacco. But then we look at ultra-processed foods. It's more recent that we've been discussing that. And this topic is being built because there is not such a clear understanding by the society and the parliament about the harm it causes. So we see some regulatory measures that are very recent. What about alcohol? It's being recognized and acknowledged as the harm it causes, and our Senator Teresa Leitão mentioned a lot of these harms and risks for health, but at the same time, there's a lot of contradiction around it. There is a knowledge about the harms it causes, maybe not as deep and concrete, and this is why this study is so important, because it lacks data. On the other hand, we don't see as many measures or actions established by regulations to try to solve this problem or mitigate problems related to alcohol consumption. There's a certain acceptance and normalization for the consumption of alcohol, so there's a lot of contradictions. And we need more studies on the topic. So I'd like to highlight this topic of alcohol control in Brazil and how the legislative branch sees that. There's a second topic I'd like to mention, the study in itself. We're very happy to be here. Of course, there are extremely concerning data, but I'm so happy to be here, being able to promote and launch this study led by Eduardo Nilsson, because it's become a landmark, I would say. It's impossible to do public policies and approve bills unless we have robust data about the topic. And this was a gap we had. And we're now filling part of this gap through this study. We are not only talking about the costs for the national health system, but there's another very interesting aspect here. It will help us understand this matter, which are indirect costs. How much Brazil loses or how much it costs to Brazil. In other countries, they're calling it the true cost, the effective cost. We look at the cost sometimes in itself, but we don't look at the overload over the national health system in Brazil, our unified system. There's a cost imposed to the society as well, and we're all paying for that. So this study brings this new piece of information. And finally, the third topic I'd like to highlight has to do with how we can move forward based on this study. Senator Teresa. Based on this study, we can turn that into public policies and regulatory actions that will help us face the challenge alcohol imposes. So we have the tax reform, it's been mentioned already, but I'd like to repeat because our Senate has been discussing this for 1 month, debating the regulation of the tax reform. And we have the excise tax. It's been provided for in the proposal sent to the House of Representatives that this taxation is higher for alcohol. So we have a historic opportunity. We count on the Senate. I'm so happy for your words, Ms. Leitão, because we know that the WHO is reinforcing the importance of taxation, but also the World Bank has launched a report on the same topic saying that this taxation must be high. And 2 weeks ago, another report was launched on the Global Task Force on taxation, showing how many lives and resources are spared if we have robust taxation over alcohol, tobacco, and sugar drinks. So it is a great opportunity, but on the other hand, we also have a lot of lobby working on the Senate and the Parliament in general. So we need to look at that too. We have to be very careful with that and paying attention to lobbyists, because we've seen them trying to reduce tax rates and also for homemade alcohol drinks to be treated differently. They're attempting on a lot of gaps and that we have on our legislation. So we need the support of the health department and ministry to face this problem and allow the measures necessary to be taken to actually be put in practice and implemented. Thank you very much, Marcelo, for your participation and your contribution and for ACT's partnership for this work. I'd like to highlight the presence of other partner organizations such as RESET, the Catholic University of Brasilia, the FGV, the World Bank, Johns Hopkins, and others. Our colleagues from Vital Strategies from other countries as well, and other partners of the civil society, government, and other organizations who are interested in this topic. We have almost 100 people here, and I'm very thankful for your presence. And I'd like to thank Senator Leitão for her talk, and also our colleagues from PAHO, Ms. Luisa Prieto, Dr. Leticia Cardozo from the Ministry of Health, and also Marcelo Bayard from ACT. And we'll move on to the main topic of today's meeting. We are all interested in seeing these numbers. You're all mentioning this study in your talks. But before that, I'd like to say that for those who don't understand the size or the load that alcohol represents to our society, the UN launched a report saying that 3 million deaths per year can be attributed to alcohol all around the world, which is about a death every 10 seconds. We'll be talking for about 1 hour. Can you imagine how many thousands of people will die in this hour because of the consumption of alcohol? So we know about the measures that will allow the individual to make their own decisions, but can also inhibit consumption. And this is what we're looking for. We want to avoid more than 200 diseases and injuries, violences, and accidents that occur as a result of alcohol consumption. And we want to work on understanding that the tax reform, as it was well understood by the Ministry of Finance and the executive branch, as well as the legislative branch, as they approved the bill of law for the tax reform in the House of Representatives, and is now under discussion in the Senate. We would like to say that the taxation model should be the one recommended by WHO, where you have a specific excise tax or selective tax, as it's as the term we use in Brazil. It has an ad valorem part and an ad rem part based on the proportion of alcohol and that specific beverage. This will be very important for us to move forward, to have the right taxation of all alcoholic beverages that have a proportional effect as you consume the number of shots or the volume of alcohol in each one of these drinks. So part of this understanding that we need a cultural change, that we need to change the normalization of alcohol consumption, it needs to go through not only through legislative and scientific measures, studies, data mapping, but we also need to do something else. We need to bring adequate information as well as campaigns. We know the role campaigns play for awareness raising and the impact they've had in Brazil to prevent HIV/AIDS, dengue, and for this specific case, the smoking cessation campaigns and the mandatory messages present in the products. This is very important to create this regulatory environment that will disincentive consumption. And then we are creating adequate incentives for healthy habits. This is what we need to do as our society, as a society, and as an ecosystem of public health. In Brazil, 92% of the population supports the government promoting measures to reduce alcohol consumption. The society feels the load, the weight, and the social cost of alcohol consumption. For this reason, jointly with this study developed by Mr. Nelson, that's why today we're launching this campaign called, it's actually the second round of the A Shot of Reality campaign. And we are going to show you the video now. And after the video, we'll invite Dr. Eduardo Nilsson for him to present his study. Would you like to have a shot of reality? Alcohol increases the dosage or the amount of violence of cancer, diseases. Alcohol kills one person every 12 seconds in the world. Even those who have never had a shot of any drink can become a victim. So if alcohol is bad for the society, it needs to have more taxation over it. It's a very clear message. If it generates more costs, it needs to be disencouraged and needs to pay part of this cost, So I would like to invite the researcher of Fiocruz, Mr. Eduardo Nilsson. We're so thankful for this amazing study he has developed, and he's going to talk about this study, about the direct and indirect costs related to alcohol consumption in Brazil. Thank you very much, Eduardo. You have the floor. Thank you very much, Pedro. I'd like to greet all participants in this webinar and the partner institutions. I'd like to start by thanking Vital Strategies and ACT. They play a key role in depositing the trust on me to develop this study. I'm very proud, and as a representative of Fiocruz, we're also very proud to be participating here. But also the civil society plays a key role, and institutions like Vital and ACT for advocacy in such an important agenda, and they are key for the health problems that we have. I'd like to thank Senator Leitão for her talk, and Pedro, the representatives of PAHO and the Ministry of Health. It's key to show that there's alignment related to this topic. And this is what we want to do by bringing these data to explain the epidemiologic load, which is unknown and very relevant. So it will important for the Brazilian population to become aware of this information, but also we want to influence decision makers, which is the case of the Senate right now, and the tax reform and the Ministry of Health. I'll start sharing my screen now because I want to start talking about these topics. One thing has to do with the fact that we are working with the epidemiologic load or diseases related to alcohol consumption, which is a key risk factor, one of the main ones for the non-communicable chronic diseases.
Well, in Brazil, what we are going to have, I'd like to point out that this has an economic impact on a part of society. But here we are thinking about the federal, state, municipal governments that, we're talking about costs that we can attribute to the health system too. So we're talking about the economic sustainability in relation to the scenario that we are discussing, for instance, a framework for the reduction of public costs. And this is very important because these are cost-effective policies in the sense that they cost little to generate a high impact on health and also savings for SUS. And here I start for a methodological approach just to try and explain why we did this study. And then first, why do we do such studies? Because when we model these type of studies that run a simulation of the impacts, it brings an approach of these different diseases, because it is, look, we need to know its load to be able to have more effective action, because this allows us to have a baseline from the starting point, offering society and the players knowledge, and that we may use the same methodology which is actually developed should be used to assess the potential of different policies, especially when we think about the tax reform continuity. We hope that alcoholic beverages remain within the excise tax, because this is going to help us to measure the different impacts of the different tax rates and how they are going to incur and have an effect on the consumption, because it's going to have an impact in reducing these costs and deaths. And as we do this, okay, the sort of math methodology may be a little bit more complex, but what we want to do is use data from population for health economic parameters. So we have morbidity, we have death, we have, risk factors in relation to alcohol consumption and the relative risks. In other words, what we found in the literature, where we have a risk factor such as alcohol consumption that leads to a higher risk for your health. And then we calculate death, we calculate diseases, and also the sort of disease load costs. And this is all evidence which is actually shared with some other methodology. There's actually known globally, such as the viral load studies for diseases. And then based on this epidemiological modeling, what we want to do is use what we refer to as attributable fraction, because it brings together so how much consumption we find in different groups of the population to then estimate cases and deaths, and then to be able to measure what we've got as far as direct and indirect costs are concerned. In here, I'm going to explain what are the direct and indirect costs and why we talk about them, because we have the whole sort of setting of costs as far as the diseases are concerned. So the first are the direct costs, which are costs with medical care. So we're going to have medical, indirect, and direct costs, because direct costs are, for instance, that the actual health system has as far as hospitalization, medication, medical procedures that were ran. But we have indirect medical costs, which are going to be paid by the families, by that individual. For instance, we also have the issue of supplementary health coming in as a direct cost, and we have indirect costs, which are the sort of society-based costs that go beyond health care, treatment costs, because a population that falls ill or dies because of these sort of disease-related factors, they're going to lead to a loss of productivity, because people die too early, so they leave the work market, so they don't generate wealth for the country anymore. But there are some other loss of productivity, such as, being away from work because of disease. And this is also something which is very important. Presenteeism, okay, because for instance, the person, because they fall ill to this disease, they end up not producing to all of their potential. So they're there working, but they don't produce everything. For instance, an example related to alcohol, for instance, people with a hangover because they consume too much alcohol the day before also implies a lack of productivity. And there are studies in other countries, but they haven't been consolidated at the international level. So we've not been able to actually include these studies here, but we are showing very alarming, relevant data, but they are conservatives in the sense that they are not actually taking into consideration everything that alcohol actually brings, but they are still very relevant indeed. And then giving continuity to indirect costs, we have some other government costs such as pension-related costs. We are going to have a big load because we're going to have early retirement happening because of diseases provoked by alcohol. We're going to have some other private costs, such as, traffic-related accident costs, which is related to the insurance sectors and other sectors of the economy that are also affected by these problems. And we have intangible costs that we are unable to measure. So we are not able to measure everything that actually happens because of this disease. But for instance, the issue of mental health, which are going to affect individuals, their families, and this cannot be measured, but we know that they are there and they're going to be very relevant in the short, medium, and long term, such as violence against women, children, which are all very relevant issues indeed and should be considered despite not being quantified in these international studies. And now I'm going to talk about the study itself, addressing its goals, and then they're actually part of the title, which is, to run these indirect and indirect cost estimates for alcohol consumption in Brazil, and specifically working with these two big components, which are the direct cost for, SUS, the Brazilian health system, thinking about the attributable cost to alcohol consumption, and indirect cost because we are using national public database. We have managed to use costs in relation to early death or loss of production because of people, missing work because they're hospitalized and everything. And we managed to bring all of this together to arrive at the disease results. And this is based on a set of analysis, which is a comparative analysis of risk, which is to produce the risk to try and attribute the impact that this risk factor is going to have, which is alcohol consumption. And we have our basic data to calculate this, which are the alcohol consumption prevalence within different age groups, gender groups. We also have relative risks, which are meta-analysis that establish this sort of dose-reply relation in relation to alcohol consumption, the different health outcomes. And for that, we disaggregate this through age groups every 5 years, starting at the age of 20, but we start including 18 also in the calculation, and finally we use costs that came from national database from SUS, INSS, and IBGE data that we have a lot of survey and studies done there. So alcohol consumption was approached based on estimates that WHO brought in the report that Pedro mentioned, which was the report on alcohol in health and treatment of substance use disorders. And here we have an estimate of consumption for countries, including Brazil, where we have a calculation done from the producing market in the country, and that translates the sort of per capita consumption, but also taking into consideration some losses, but brings you some reality. We also have an adjustment done to this because as we are working with groups based on gender and age to adjust this consumption, which is what WHO did for each sort of age group, gender group, and taking as a base 2019. And then as far as public data is concerned, we have this mortality, and then we have this very rich public data policy in Brazil. So we have a lot of data that can and should be used by researchers, civil society, by the parliament, by managers, because This data brings a lot of relevant information about the impact of diseases, the cost that the diseases bring, that we can work together with studies such as this that I am addressing. And we also have data from the IT department from through such as mortality, hospitalization, sort of outreach clinic costs, indirect costs. So we have the possibility of many inquiries, such as the PNAD, which is a continuous household sample national survey. We also have another common issue that they have is identity data for, again, gender, age, and identifying the diseases associated within this methodology, which is linking up the alcohol consumption to each of these diseases. And a common question that we ask is, why are we using 2019 as a reference point when we are in 2024 already? But this is on purpose, because what we are doing is trying to find a baseline which is going to be compared as the starting point, and 2019 is the reference year for the estimates as per the WHO reports, as well as the last time the health survey was ran. So these are reference data. This is pre-pandemic, which means that we need to run new analysis thinking about the changes that we actually saw after the pandemic. And we have the new PNS, which is actually being done by IBGE now. So we're going to have some updated data very soon about consumption. So we're going to be able to run some new analysis and based on these different trends. But we know, okay, that we have some other surveillance mechanisms such as the VGTEL, which is a survey which is run every year by the Ministry of Health in relation to risk factors to chronic diseases that shows that there has been an increase in alcohol consumption. This is worrying because we're talking about consumption amongst younger people and women. So this potentially speaking, this increase and the change of the whole sort of impact profile, consumption profile that we're going to have after our study. And here, reinforcing Senator Teresa Leighton's comments, which were actually very good. But, you know, we need to leave this natural acceptance of alcohol to the sides. And then this it is really scary when we think about the number of diseases that are not seen much. You know, we have a much more common association with, you know, liver diseases. We know about the risk in sort of traffic accidents and the relation to alcohol consumption, but there is a great number of diseases such as respiratory, cardio diseases, many different cancers such as digestive system cancer and some other diseases which are not actually traffic accidents, interpersonal violence, including violence against women, against children. So we have bigger implications here. Also sexually transmitted infections, HIV/AIDS, which again has this relation of safe sex with the consuming of alcohol. And here we have the identification of each of these diseases. We're talking about 24 diseases that have been incorporated to the model. And here we have a table of a lot of numbers, but this is very important. And here we come to the premises that Dr. Letitia mentioned beforehand, based on the evidence that were actually incorporated to the model. First is that there is no safe level of alcohol consumption as per scientific literature. And another very relevant issue is that we have a dose reply sort of sample as far as alcohol consumption. So if you increase consumption, you increase your risk. And then the table is trying to show this in a more detailed manner, because for each disease, we have consumption of 0 dot something grams per year. And then for you to have an idea, 12 grams a day is what you get in one like beer can. So if you drink a beer can every day, you get this, and risk increases the more you consume. And there's not a linear relation to most of them. For instance, for tuberculosis, the risk increases in 10% when we have 12 grams consumed every day. And this increases to 53% when consumption is doubled to 24 grams. And this happens to all these diseases when we talked about cancers, cardiovascular diseases, which are these diseases that have a great social and economic impact, of course, in population. And then here showing the first result, which is its intermediary result. But it's very important to point out that we have, for instance, alcohol consumption in population in the different sort of groups that we mentioned. And then, as we mentioned before, this was expected. There is a higher consumption amongst men, and this is a consumption that starts at a young age. But we have complementary evidence that basically talk about the increase in consumption amongst women, amongst young people. And this is important data for us to think about message policies. But of course, keeping in mind that we're going to have a big impact amongst men when we think about this level of consumption, which is much higher in all age groups. And then we started with a big result here, which is incredibly relevant, but at the same time worrying, that Pedro mentioned that the number of deaths is 104.8 thousand deaths a year attributable to alcohol. And here on the table, we point out the those are the four main disease groups that we're going to have in relation to mortality load, including cardiovascular disease, accidents in first place, and then followed by cancer, digestive disease. And then when I talked about men, this higher consumption, we're going to have more men die, but it's also a big load for women. And here is important that in addition to distributing the different causes of deaths, which is very important and relevant, we have this load in relation to violence and accident, but something which is incredibly worrying for women as well as men, but this is higher for the big number of death of young people because of the result of violence, the result of accident. And this is something that also is translated here. And then we show the peculiarities that shows a big mortality load for early death because this increases economic load that we are going to have in the perspective that we are going to have the reduction in this group, in the population, this group of workers who are in their full productivity sort of working force, and they're removed from the workforce, and this has a very relevant economic implication. And then I start summarizing the results as far as cost concerned, because we have this big number, and this is a very worrying number, okay? 18.8 billion reais in direct and indirect costs for Brazil. In other words, over 1 billion in federal costs to the SUS, the health system, and then you have a 17.8 billion of the indirect costs, particularly related to early death. Because as I said, this is a great impact because it is, individuals who no longer produce wealth because they're no longer part of the working market because they've died. And then we go specifically in the direct cost for the SUS. We have this great impact, particularly in relation to hospitalization. So we have a replication of what we've seen before in relation to disease distribution that we observe through mortality. So we have a very big impact of diseases in the digestive system and cardiovascular diseases. And we also have a lot of violence, accidents, cancer diseases also. And then we also have the mortality. And then we also have hospital costs for younger people, men as well as women, but particularly amongst men. And we can see actually that despite this disproportionate a figure that we've got as far as consumption between men and women, we have some worrying data. For instance, that we have pretty much half of the cost in comparison to men for cancers. This is amongst women, which shows a very, despite having a higher consumption. So this look but the sort of increased consumption with the female gender again is already a worrying, and we need to pay attention to this in relation to sort of hospital procedures, healthcare procedures that are actually ran. This is even more severe. And here we're talking about 224 million reais every year. And here we have a sort of inversion as far as cancer treatment is concerned. We have more costs with cancer treatment for women than men. So this shows there's vulnerability already manifests itself because a lot of the cancer treatment via the SUS happens at this level. So we're going to have 101 million reais every year, but showing that we have a distribution which ends up being less proportional because we are we see more women look for healthcare than men. But then again, this is very important because we need to say that despite having lower consumption amongst women, we have this big concern that the more consumption, the higher the risk. And then these costs will, of course, increase if consumption increases. So this is more really something that we need to think about. Public policies is actually essential. And then when we have this concern with indirect costs, which are significant because these are costs from the national economy itself, when I was talking about the big economic load of people being removed from the work market in their productive age. This comes because of early premature death, and this is around 17 million reais. And here we have this concentration of the big loads of the individuals that were within their productive life, 35, 40, which is when they are going to actually have this. And it is important to mention that we've had an increase of this premature death, particularly to younger people. And this case is going to have a higher impact on life. So this is an impact that we are not going to have this consumption that we've got, but it's very important thinking about the actual load itself.
So we have discussed the costs of pension in Brazil and welfare, and we are also discussing formal workers. We're leaving aside a group, an important group of the population, which are informal workers, and it's impossible to measure their impacts. But we are showing that we have a huge burden, and for example, of cardiovascular diseases, but also cancers. We can see it here as well in terms of early retirement and a large proportion among women. We also see digestive diseases and violences and accidents. They're all very important and they cause a huge impact on the male population. So we do have an impact that we need to work in terms of policy because they are consequences of the disease, and it can cause early retirement, for example. And we are also using absenteeism, how much people in the formal labor market miss work because of these leaves and hospitalizations. So we're also discussing shorter leaves or absences. For example, sometimes a person needs to go to the doctor because of that, and we are considering those days as well. So when we're talking about 644.3 millions caused by absenteeism, we have a larger number than what we have here because we're not mentioning informal workers. A lot of time, if they don't work, they don't make any money. So it's a worse impact. And it's very important in social terms. And it also has to do with the impact of these diseases. We had been reinforcing that, but some diseases such as cancer, cardiovascular diseases, and cardiovascular diseases not always are associated to alcohol consumption, but they do represent a huge load on men and women. And we need to highlight that again. There's a huge burden over people caused by accidents and violences. And I had mentioned that a lot of these diseases we are mentioning here, because they're non-communicable chronic diseases, they are usually developed in the middle and long run, usually after people turn 40. But there's a specific issue related to accidents and violences because they affect those who take alcohol, but also those around them. These are people that can be affected by accidents and violences. These are immediate consequences. So we can think of a modeling considering time, we would still see an immediate impact of alcohol consumption regarding accidents and violences, not only interpersonal violence and self-directed violence, but also violence against third parties, be it directly or via accidents. These are key things that are related to these results. And we need to think of the benefits not only for those who drink alcohol, but the society as a whole. And I will close by sharing the next steps. I've highlighted we have this research, this study as a landmark, as a baseline. I'm very proud to be part of this movement and this historical time, a key moment. I hope these data are very useful for the civil society, for the Senate, who is now discussing the tax reform, but also health managers and the federal managers of the national health system, so that they can work together based on this information. And this study can also be used to model other public policies. For example, we hope we can define tax rates that are ideal so that we can have more tax collection and the reduction of consumption, which is what we really hope for. And in social terms, of course, we have differences within our population, the Brazilian population, and we need to disaggregate this information by gender, race, color, and also geography. And we also need to build other models that can be even more robust as data available and evidences available allow it to occur. And I'll close by saying that we do have necessary measures. We have campaigns, they're excellent. The second round of this campaign brought by Vital Strategies in partnership with ACT and other institutions, because it's key to bring information to the population, to lawmakers, especially regarding these more invisible issues, and to break this normalization of consumption, as our Senator Leitão has mentioned. There's no safe level of consumption of alcohol. It is a public health problem, and we need to reinforce that. WHO talks about more cost-effective measures, and they're covering this very specific risk factor. So the first one, which is recommended by them, is the taxation of alcoholic beverages. And we are having a very important discussion of the tax reform and the excise taxes being discussed over that. And we also need to include tobacco and alcoholic beverages as a whole, and also sugary drinks, because we want to foster this excise tax over these products and ultra processed foods as well. We are covering these three main risk factors in our tax reform. But moving back to alcohol, these are things that we learned based on the tobacco agenda highlighted by Pedro. We have a common history which is harmful to health, but it's normalized in the society. And this is a historical moment to turn that, to have measures such as taxation and other measures related to publicity restriction, the restriction of events, because the alcohol industry sponsors sports events and popular festivities, music festivals. We need to change that. Tobacco used to play this role. And there are many sectors, productive sectors in the private sector that can and wish to sponsor these events. And finally, the availability of consumption and everything that we need to do to reduce consumption and to surveil um, the consumption of alcoholic beverages around schools, near to minors. So we are going from the taxation, but there are many other measures, and we can prevent a lot of preventable diseases. And it's the responsibility of the government and also the university, the civil society, the academia. We need to play this active role. We have, for example, Vital Strategies and ACT playing an active role, and it's very good to see that. Thank you very much. Thank you, Eduardo, for your partnership, for the study. I really thank you and Fiocruz for such an important study. You've mentioned that it is key for us to discuss public policies based on data and evidences, numbers, and costs. It's key that we have such studies and that we follow a long time how new information can qualify the study, it can better detail it. We have adopted a conservative approach, and we know the cost is even higher, even though it's already scary as we see it in this report. But it's not only bigger, but it's likely to be much bigger. And we need this type of information, and we need to give this first step to guide new models to follow and monitor the impact of public policies. We've seen that in other countries, and we hope that we can see that happening in Brazil as well. So we've had the honor to listen to different partners and representatives of relevant institutions in this discussion today. The presentation of the campaign and the study, I'd like to invite our Director of Non-Communicable Chronic Diseases to lead the discussion panel with other guests that are also specialists in the field, so they can answer the questions you may have. Questions, comments, you can use the Q&A box for them. Thank you, Luciana. Good morning to all of you. It's a great pleasure to be here after listening about this study. And I'd like to invite our panelists, Barbara Caballero, the representative, the National Secretary, Marta Machado from the Secretariat of Public Policies in the Ministry of Justice. I'd like to invite Luciana Cruz, the Chief of the Technical Field of Food and Nutrition, Cancer and Physical Activities, as well as Marcela Monteiro, a specialist on alcohol and a senior consultant for more than 20 years at PAHO in Washington, and also the coordinator of the Program of Substance Abuse at the WHO in Geneva. So we've heard that we're dealing with a topic that is very naturalized. Its use is naturalized in Brazil, and of course, it's a hegemonic agenda. We can only have positive results related to this problem in Brazil if we have an intersectorial agenda. This is why we've been inviting so many of you, and our panelists come from different fields beyond health. 18 billion per year. This is the number presented by Eduardo in his study of direct and indirect costs. It's a lot. If we think about that being used in other public policies, it's really impressive. So we have this opportunity, the tax reform right now, with an increase of taxation based on the excise tax. And we also need to think of prohibitions, restrictions of exposure to alcohol and availability. And also to think that publicity today has increased a lot on alcohol. And there are specificities of internet and social media, which are not well regulated. And also the minimum age of consumption. We have the Brazilian law covering this topic, which prohibits selling to younger people, to minors, but we've seen that it's hard to control delivery services. So when we listened to Eduardo, when he mentioned cancer and how much it affects women in hospitalizations and other visits to hospitals, we've observed that from 2006 to 2023, there was an increase of abusive consumption of alcohol of 15.7 to 20.8. However, for women, the prevalence has doubled among women. So we need a lot of efforts. We need to get together, the government, the academia, the civil society, so that we can truly cause an impact in public policies and reduce alcohol consumption. And also to improve living conditions of the population and use this money, this resource that's being spared, to other treatments and other actions for promoting health. Now, I would like to invite Maricela Monteiro for her to make her comments about what was discussed here. She has a broad knowledge in the international level. And maybe she can talk about the importance of this data and how we can use them based on the experience she's had. Thank you so much. I'm so proud to be here, so honored, and see this progress in Brazil with this type of study to inform public policies. This is the time for this study. There are other international entities such as the World Bank and the Commission and the Committee on Taxation over Health Risks, and other documents launched internationally, which also mention Brazil. The World Bank has a specific note that was just published some weeks ago on that, and it reinforces what the results and the outcomes of this study. And it shows that this is a good political moment, a very important one for us to spread this type of information. The second topic has to do with the environment, the alcohologenic, like I like to say, environment, the acceptability of alcohol consumption in Brazil, which is perceived by people in a distorted way. And the massive marketing by the industry on the consumption of alcohol. And also, people in general usually think about culture. We've always drunk. In Brazil, it's part of our culture, part of the norm. But we forget the history, the negative history that we've had with alcohol consumption during the times of slavery to explore vulnerable populations, including indigenous populations. And it has had huge consequences. Brazil, as a colony, and had the sugarcane production, which was sent to Europe and left a lot of negative consequences in Brazil. And also, we had the modernization of the society, the development of the country, which caused an economy to generate less jobs, less than we expect, because it's automated in a lot of fields, especially for the production of alcoholic beverage. But the population doesn't have this information. So we need to bring more information to educate the audience, the people in general, because acceptability has to do with this marketing, which is massive. It's still massive. It's like Luciana said, on the internet, on social media, where there's no regulation whatsoever. Internationally speaking, few countries are now trying to control that. What about the results? They're impressive, but also underestimated, as it's been mentioned. I can give you an example: the cost of the destruction of property and police action, the judiciary system, they are not taken into account. Also, harms to other people when one person is intoxicated and kills or hurts another person. These are not taken into account in the way the health data it is recorded a lot of times. And also the use during pregnancy, which can cause not only the alcoholic syndrome for babies, but also abortions, miscarriages, and babies that are born dead. So there's a lot of problems related to pregnancy and alcohol. We don't have enough data to measure them, though, but they do occur. And when we think about sustainable development, how much drinking water is used for the production of alcoholic beverages, all types. A liter of beer, for example, takes about 300 liters of drinking water, both for wine and spirits in general. So we need to measure that as well in order to plan the development of the country in the future. Finally, we are talking about the damage against women, to women, not only their consumption, but also violence being measured in this study. But it's difficult to associate the proportion of violence against women based on only or alcohol consumption alone, and also the loss of productivity of women as caregivers within the family environment. You may have children, parents, or partners who consume a lot of alcohol, and it affects the possibility of that woman growing and developing and reaching economic equality. So alcohol consumption favors the expansion of inequality, gender inequality, I mean. And the data presented here, especially for cancers, can be added to this other aspect. So I'll stop here, and I'd like to congratulate the authors for this amazing study. It's very important and also vital for helping funding this study.
Thank you, Maristela. Thank you for your contribution. Always so important. And you mentioned a point that we need to pay attention to, which is the issue of the environment. When we talk about water, waste, we need to see that as a cost that would not be an indirect cost, really, but it is a direct cost in other sort of lines of production. And I think that this can also be written down as another point for discussion for future studies. And now I'll give the floor to Dr. Barbara, who's a director at the Ministry of Health. We know that there is an underestimation of the results, really, that we could actually be assessing as a cost. But within public security, this whole sort of public security bias, all the costs that we've got as far as police agents that need to work the accidents and incidents, if you will, resulting from alcohol consumption. I'd like to hear a little bit about your comments, your opinions on all of this. Good morning, Luciana. Good morning, everyone. First, I'd like to thank you for the invitation to attend this event. So I'd like to thank you and also Pedro de Paula, and on behalf of everyone, please receive my greetings. From ACT, Fuel Crew is vital, and I'd like to congratulate you for the quality of this work, the quality of the information, and the importance of having these public numbers being discussed currently here. I am the director of the survey and assessment in the National Secretariat of Drugs Policy within the Ministry of Justice and Public Security. And as a manager, we know how important these data are to base public policies on, particularly in this moment when we have such a relevant discussion of this, selective excise tax within the tax reform. So this type of information is something that needs to be discussed, published. We need to ensure that reaches evidence, as it were, so that we can make the best decisions possible based on such information. And in relation to this, I'd like to inform you that through the Secretariat, we are working in the reformulation of the Brazilian Observatory of sort of drugs policy that we are going to release next year. And the idea is for it not to be just a data repository. So we're going to have these databases that have been used in the study, the databases from the Ministry of Health, which are critical for mortality, for hospitalization, and some other databases done for alcohol and drugs policy. But beyond that, the observatory has the purpose of being a big institutional network. And I believe that the partners here today are going to be very well represented in the observatory. We're going to be able to share many studies, not just done by the Secretariat, but by our partners also. such as the study that we are publishing, today. And it is shocking, really, to see this number, 18 billion, thinking that these are the economic costs. We're not even talking about the loss of life, which are the biggest losses that we can have because of the uh, abusive use of alcohol. I'd like to thank Dr. Maristella also for reinforcing this dynamic of the consequences of alcohol abuse for domestic violence, for the life of women. So many impacts that we can't even really measure precisely with an objective number. I'd like to congratulate Eduardo also for the work of really, explaining what are the direct, indirect costs and intangible costs, which are always this sort of hidden number that we are unable to actually have a precise number for. But this number of 18 billion reais shows the importance, the relevance of the information. And I'd like to reinforce once more in this moment that we do indeed need to discuss public policies and the decisions being made on the alcohol excise tax. In addition to this, I'd like to congratulate and reinforce that these policies are a priority at our secretariat. We have been engaged in partnerships with organizations, universities for us to discuss this topic. Okay, so that's all I had really for now. Congratulations. Thank you, Barbara, for your kind words. We do indeed need to look at these costs that sometimes are hidden, they are invisible, as it were. We only look at what we can actually see, the numbers, such as tangible costs, as it were, such as mental health that affects not just the consumer, but the whole family, society in her surroundings. It's very important for us to think about this. And now I would like to invite Luciana to give us her comments. She's from the National Cancer Institute, INCA. So, Luciana, I mean, of course, you had this numbers in your head before, but what did you think? Maybe you didn't have the sort of cost amounts, but uh, how much it affects women in, hospital appointments, doctors' consultations, in hospitalization, despite a lower prevalence. But as I mentioned before, we have the double of women consuming alcohol since 2019 now, while men sort of alcohol consumption prevalence is kind of stable, increases every now and again in a year or another, but women's consumption has really increased a lot. And we see the result of this, with more hospitalization. So I'd like to hear from your experience related directly to cancer. So what did you think? What are your impressions from these results? Well, first, I'd like to say good morning to everyone on behalf of our Institute General Director, Dr. Gilberto Gil, who unfortunately could not be with us today. I'd like to congratulate and thank Fiocruz, ACT, Vital, for being here today, and also congratulate you for organizing the whole study. One of the principles and guidelines of the National Cancer Control Prevention Policies related to health prevention promotion is for developing public policies to face alcohol consumption, which today evidence shows is one of the main risk factors related to cancer development, as it were. And within this context, we've been developing a number of actions in relation to alcohol, producing evidence, producing educational material for different audiences, the general population, health professionals, legislators, training professionals, particularly those that work in primary health care, which are the ones that have direct contact with the population, and also putting together technical notes, documents, positionings with the goal always of contributing to discussions that are being held currently, particularly now, to inform the tax reform. Now, talking a little bit about cancer evidence and reinforcing the results of the study presented by Eduardo, the cancer effects from alcohol are very well established in literature. There is no doubt today that alcohol is one of the main risk factors for developing cancers. International Cancer Research Agency classifies alcoholic beverage as a carcinogenic agent in group 1. And then this is the same group as tobacco, for instance. So in the same way that there is no doubt between the relation between cancer and tobacco, there is also no doubt between this relation, alcohol, cancer, and evidence shows that consuming alcoholic beverages is very strongly associated to at least 8 types of cancer. And then among them, I'm going to draw our attention to breast cancer, talking a little bit about the results presented by Eduardo when he points to the fact that spending, expenditures on health treatment with women is higher than for men. Okay, the associated cancers with alcohol, we have mouth, liver, intestine, colon, rectum, breast, and also stomach cancer. And here we are talking the most prevalent cancer in the Brazilian population. And here there is a special highlight for breast cancer because this is the most common cancer amongst women in Brazil. And this really goes to reinforce the results of the results. And one of the biggest challenges for cancer is to promote social recognition between the increase of alcohol consumption and the increase of the risk to developing cancer, which is different, for instance, smoking, which is completely accepted by the population as a risk factor for cancer. Drinking is not very well known by the population as a risk factor to cancer. Studies show that only 50% know about the relation between alcohol and cancer. So we need to move forward urgently, in recognizing this at the social level. We need to disseminate these data results, and this always leads to motivation for publicizing on, social media, on the media itself, because this supports the dissemination of this association to the population, thus increasing its recognition. And as this has been said here already, alcohol beverages consumption has been increasing at shocking rates in recent years. When we observe the population that depends exclusively from the SUS, the Brazilian Public Health System, between 2013 and 2019, alcohol consumption doubled amongst men and increased fourfold among women. So the increase of alcohol consumption amongst women was very significant and really draws our attention once more. Talking about the data from the study in 2019, we had 9 in every 10 Brazilians that consumed alcoholic beverages. And when we talk about cancer, it's always important for us to point out that the relation between alcohol and cancer doesn't really depend on the quality of the drink, okay? This is something which is discussed particularly with marketing, advertising for alcoholic beverages. The relation between alcohol and cancer is the exposure to ethanol and its metabolites, and this doesn't really depend on the type of alcoholic beverages consumed. For some types of cancer, this relation happens very much with the sort of dose reply. So the bigger the consumption, the higher the chance of developing a cancer. Here at the Institute, we 2 years ago also ran a expenditure estimate study, attributable expenses that would, and then as a sample for cancer treatment, the study estimated that alcohol consumption was responsible for 81.5 million direct federal expenditures in the public health system with the treatment of the disease in 2018. And we projected these expenditures for 2030, and our estimates showed that these expenditures are going to be approximately 203 million, which basically means an increase of over 100% of expenditures in the health system only because of an increase in alcohol consumption without taking into consideration any other sorts of exposures. And as mentioned by Eduardo in his presentation, our results are underestimated without a doubt because our study only included part of the expenditures because we only considered hospital procedures and consultation related procedures in patients with at the age of 30 or older. So we estimate that the expenditure to cancer treatment attributed to alcohol is probably much higher than the amount that we found in this study. But what draws our attention is this projection of the expenditures with an increase of 150% in a period of 10 years. And then we ask the question, okay, which health system is going to be able to support, withstand this significant increase, taking into consideration everything else that has been mentioned, because all of these funds are allocated for treating cancer. It could be, of course, allocated for improving treatments and other actions. And then considering what we have been doing within the Institute to support this agenda, so we have our contributions in the alcohol agenda. In June this year, we published an evidence map for the reduction of alcohol consumption. This map has a number of studies that assess the impacts of different actions throughout the world for reducing consumption of alcoholic beverages sales, and also this year with the goal within the discussion of the tax reform with the aim of helping contributing to this debate. We published a document presenting Inca's institutional position in relation to alcohol consumption, and our positioning is in line with the guidelines established by WHO that recommends adopting effective policies and strategies aimed at controlling the ease of buying as far as these products are concerned. Also policies against, drink under the influence, regulating advertising, which is also very much discussed, alcoholic beverages, marketing, its association with culture, sporting events, and particularly increase the price of alcohol products, because a lot of studies shows that increasing price, one of the most cost-effective measures for promoting healthy choices. And then Inca understands that increasing taxes on alcohol beverages and products is essential for promoting health, and that the tax reform is a very important opportunity for us to actually move forward on this measure. This essential debate for us to move forward in this measure that we believe to be incredibly relevant for cancer prevention. So I think this is what I had. I'd like to once more thank you for the invitation on behalf of our director, Dr. Gio. I'd like to congratulate the researchers, the organizers of the event once more, and I am here at your disposal to answer any questions that you may have. Thank you very much, Luciana. The data you brought to us are incredibly relevant, particularly and specific to cancer. We see that there are many angles that need to be studied, supplemented, so that we can arrive at this cost for the country, these numbers and how much of an impact this has on the quality of life, or not in the quality of life of people, and all of this related to alcohol consumption. I'd like to invite Pedro Di Paula Marcelo and researcher Eduardo to join us with our panelists, because we have some questions, and I am going to steer through the questions so that we can answer as much as possible. We have a question from Paula D. Freitas. She first congratulates us for the excellent event, but she has a question in relation to the data used, because we use data from WHO. And why do we not use the national data? Because WHO recommends the use of national data when available. Okay, this I'm going to answer. Okay, everyone is going to have access to the final report for this study. And Eduardo used WHO as well as national data, okay, from the National Health Study. He put in his presentation, 2019 was the year of choice because they also had the data for the National Health Survey, and the cost varied With the WHO data, we have 18 billion in costs, and the PNS data, the amount was 10.1 billion. So we're talking about expressive figures, but we chose present in this forum at this release using WHO data, but everything is described there. All the methodologies that we use, the same table. So we have both results there. Okay, I'd also like to thank Grazi Santoro. She's from the Female Alcoholism Association, and she raises something very important, whether the costs related to alcoholic dependence have been considered, and if not, would they be considered chronic non-communicable diseases, or do they come in as a mental disease? I'm going to ask Eduardo to answer this question, and she also asks, drawing attention to those women who, had the bariatric surgery done that they treat within the association. They end up gaining a lot of weight back, and around 35% of these women, they use alcohol. So do we have any expectations of including these costs associated to women, men who, undergo through this surgical procedure? And then finally, she brought there's one clarification saying that the fetal spectral disorder results from alcoholic women with autistic children in association, where they treat these women, not just the fetal alcoholic syndrome disorder, but they also have women who are having autistic children as a consequence of alcohol consumption. So she brought this a point for clarification. I'm going to give this question to Eduardo.
Thank you for your question and also for the reaction of all of you to the presentation of the results. I'd like to reinforce the answer Luciana gave to Paula. Yes, we have chosen to bring the two forms of calculation, adjusting the consumption according to WHO, and the other measure. We chose to follow WHO data because they work on the compatibility of data among countries. So we wanted to use the advocacy data of WHO to dialogue with them. But it's like Luciana said, the severity is the same regardless of the sources of data. And Grazi Santoro asked a very important question. I apologize for not having highlighted enough during my presentation, but we also included diseases that are directly attributable to the use of alcohol. And this is what we've observed. Lack of information. Lack of access to treatment is very present, and they have a lot to do with the costs. Maybe there is a lack of identification of these problems by health professionals, and it ends up creating a gap that requires responses in terms of public policies, and also to deal with alcoholism as a public health problem. Unfortunately, although it was part of the calculation, it didn't add to costs a lot, maybe because of these two problems: access and identification by health professionals. These are two very important points to be considered, especially as a message to public policies based on these results. Thank you, Eduardo. Now I have a question for both Barbara and Luciana. Maybe both of you could answer this question more specifically, but then I can listen to Maristella as well regarding to the subnational level. We brought national data, but what studies can be done to add to this study in the municipal level, so we can identify how public policies should create strategies regarding alcohol consumption? So maybe Luciana could talk a little bit about the cancer part of it, and then Barbara on the recommendation by the legislative branch. Well, regarding municipal strategies, we usually offer workshops and capacity building for health professionals in primary care. We usually cover the health professionals, the audience of these workshops, to raise awareness regarding cancer prevention, not only for alcohol, but other risk factors as well. So we suggest a mobilization and partnership with the managers in their municipalities, offering support to different actions of a tax reform, regulation of marketing and publicity in general, because we understand these are very important times to promote the recognition of risk factors that can lead to cancer, that increase the risk to cancer, but also to mobilize the population so that they can support such measures. And we find this difficulty, which is how we communicate to and with the population, especially bringing them close to us, to our side, the population, I mean, to support such measures. Especially for developing local actions. This is how we work. We also devise and write the draft documents, and we send them to the Secretariat of Health explaining why we are promoting such workshop and counting on their support, asking for support of the managers and authorities to support the development of actions for preventing cancer, working on these risk factors that we cover in our workshops. Barbara? Directed actions in the subnational level. Of course, yeah, sure. At Senad, we offer a lot of courses and workshops for public agents in any level through partnerships. Recently, we started a project with Fiocruz. This is to raise awareness of municipal guards when approaching people living in the streets, vulnerable population, by the use of alcohol and other drugs. So we've had a partnership with Fiocruz, and this workshop is going to be offered by the Ministry of Justice and Public Security, partnership of Senad and the other secretariat on the use of drugs. And we also have other alternatives of workshops with other players. We also bring events to discuss our actions and publications. We have forums. We will have one in the first semester of next year. And it's a partnership with the Hospital das Clínicas of Porto Alegre, and we'll invite players in the subnational level as well. The municipal level, I mean. And at this specific moment, right now, these are the actions that we have with other players in the field of health and safety and security as well. And in the municipalities, because they are in the end closer to the population. And this is why we've been investing in these projects. Thank you, Barbara. Maristella, what about your international experience? Could you share some of them with us? And also the importance of focusing on subnational levels. Thank you. This is one of the classical examples used worldwide, which comes from Brazil. The experience of Diadema, curfew for selling alcoholic beverages. It was very effective for decreasing traffic violence, homicides. There was a reduction of 33% of homicides in Diadema with the curfew for selling alcohol. And also in the there was also a huge decrease in domestic violence. So the municipality is a very important entity, undoubtedly, for the implementation of these policies, especially when we talk about controlling locations, times, point of sales for minors in bars, to impose the law, to fiscalize and surveil, to enforce the law, and also school education. Not allow the industry to go there and teach them about alcohol in public schools. We've seen that before. There was such attempt in Brazil. And I know that in other countries, in primary schools, the industries are funding and teaching about non-alcoholic beverages, the mocktails. And this is teaching children, because they use the same glasses for a martini, for a wine, and even promoting zero alcohol beer among children. So we cannot allow this to happen. Oh, also another measure is related to safety and traffic, which is usually conducted by the municipal authorities. Thank you very much for your amazing participations, for your talks and the data you've conveyed. You're always welcome for us to work together. We offer our support as well for the promotion, to work with the promotion of health, vital strategies, and ACT. And now I'm going to give the floor to Eduardo so he can give his final comments, and then Marcelo, and then I'll give the floor back to Pedro. Eduardo, you have the floor. Thank you once again for this partnership and for the participation of all of you here. It's very important to discuss this topic, alcohol consumption as a problem of public health, because there's so many specific actions related to public security, gender, age, and so many other things. So we need to highlight this problem of public health and to explain how much it represents in economical and epidemiological loads. It costs a lot to our society. And this is why we need to have this information among many other evidences to strengthen cost-effective measures. And one of them is the discussion of the tax reform. So we hope this data can offer transparency and visibility necessary for us to move forward in our policies, and also for us to take other necessary measures to generate health among the population. And this disincentive harmful behaviors. Of course, we're talking about price when we talk about taxation, but then we can move on to other areas such as publicity, for example, and other measures to protect the health of our population. Thank you. Thank you, Eduardo, for your work, for your effort. And I'll give the floor to Marcelo. Thank you, Luciana. I just want to congratulate Eduardo for the study he just presented. It is a landmark, and it will help us a lot in raising awareness of the authorities, especially the executive branch, which is very well representative, but also the legislative branch. We had Senator Teresa here, and I think that this study will truly represent a landmark for us to reinforce and strengthen a coalition of the civil society. But not only that, players of the government and public health as well, so we can, public power as well, so we can move on with this agenda. It is permeated by contradictions. We have reasonable awareness, and I feel that at the end, but at the same time, there is a lot of influence of the industry and other reasons. There is a lot of acceptance of the consumption of alcohols. It was important to talk about the resistance we have in implementing certain measures that would be key. But I think we are building critical mass. and social density of this topic, and also the social forces that moves us ahead. So I hope this partnership and this study and this interaction of all these players that can truly become a landmark to move us forward with alcohol control. It is a key agenda. And also the tax reform, we still have it going through the Senate a month ahead, and we hope that we can use this precious moment to move forward other necessary agendas mentioned here. Thank you. Yes, we do have a huge agenda ahead of us, and we'll be working together. We will have a more power to work on these fields as we gather more evidences. And now, Pedro. Thank you, Luciana, and all of you who were here with us today. It's like I said, many of us have said that as well. This is a great opportunity, an opportunity for a whole generation. We can do with alcohol what we did with tobacco some decades ago, more than 2 decades ago. And also the impact it has in people's lives, not only billions of reais, but hundreds and thousands of lives spared. And I think it's mandatory. It is our obligation as a society to move forward with this agenda. So I want to thank everyone who have been devoting their time and energy to this agenda and who have been here with us today. I would also like to thank all the organizations that are working together on behalf of Eduardo Nilsson and Fiocruz. Through them, I'd like to thank all the other institutions in the academia, in the different multilateral organisms and government and so on. And finally, this webinar will be made available on YouTube, Vital Strategies Media YouTube channel, and you will receive the link of the recording by email. And also, we've made available on the Fiocruz website the full study, and also at the campaign website, where you will find the material of the campaign and the study developed by Eduardo Nilsson. So thank you very much for your presence here this morning, and I hope we can move forward in such an important agenda for Brazil. Thank you very much, and have a great day.